Hi, I'm Kitty McCall-Smith with Cancer Center for Healing and Center for New Medicine here in sunny California. So we want to welcome all of you to our Facebook Live events. We have them here each Monday at 4 p.m.-ish Pacific Standard Time. We want to make sure that you join our network. You can get on our email list at centerfornewmedicine.com or cancercenterforhealing.com, and we'll send you postings of educational seminars, podcasts, and especially these Monday practitioner Q&As. Now, these are set up where you can actually ask live questions. So take a look. We'll send you an email blast. We'll let you know when the practitioners are speaking, what the subjects are, and then all you have to do, make sure you're on our email list, and then you'll be ready. And then at 4 p.m. Pacific Standard Time to close to 5 p.m. Pacific Standard Time, you'll be able to ask them, and we'll make sure your questions get answered, okay? And with that, we want you to join our healing community, because we feel community is healing. It's all about family, friends around you, and community. And so we ask you to share this with your network. Pass it forward. We are into education, and we want to heal the planet. We want to heal the world. And with your help, we can make that happen. So tonight, we have a beautiful, wonderful Dr. Bita. She's a medical doctor. She works with our Center for New Medicine side on prevention and internal medicine, autoimmune, and then she also comes over and she's working with our healing patients and our healing side. So she does a lot of different types of patients and knows a lot of different categories of things. So with that, here is Dr. Bita.
Thank you. Thank you guys for tuning in and listening. Thank you guys for coming. So today I'm going to talk about Hashimoto, the autoimmune disease to your thyroid. I see a lot of patients coming in, I've just been diagnosed with Hashimoto. And they're not told that there is stuff they could do to reverse it. Hashimoto is not an irreversible autoimmune disease. Basically, first I want to mention that 27 million Americans get diagnosed with thyroid diseases. It's very high. So I thought that would be a good topic to talk about today. And Hashimoto, basically what it is your body develop antibody against your thyroid, attacking your thyroid tissue. And I always tell patients there is really three main causes for this to happen. And we're going to discuss about the three main causes. And one of the things patient can present is a low thyroid. Even though the thyroid in the blood looks normal, the TSH is fine, free T3 or T4 is fine, but they're still presenting as hypothyroid. They're feeling fatigue, memory loss, constipation, cold extremities, cold hand, decreased diffusion of blood to the hands, weight gain, low metabolism, depression. These are all could be sign of low functioning thyroid and even Hashimoto's. And chronic fatigue is very common. So I thought that would be a good topic to talk about and educate people, because you could actually reverse your Hashimoto. So one of the main causes of Hashimoto, how do you know you have Hashimoto? Hashimoto, you could have normal thyroid function, but you could have elevated antibodies to your thyroglobulin and ATPO. Thyroid peroxidase could be elevated. Your thyroid function could be lowered or could be normal. So that's is diagnosed that way. It's just a simple blood work. And then what you do is, number one cause, I always tell patients, could be gluten. Gluten can cause Hashimoto. Isn't that amazing? How simple, just by removing gluten, you could reverse your abnormal thyroid function. So that's number one thing I usually start patient with, avoid gluten, but sometimes even wheat product because they're contaminated with gluten. So after doing that, and usually I have them maybe do some sort of liver detox, liver cleanse as well, because liver is major organ that produce the hormones. Even majority of your thyroid is formed in an active form in your liver, which is interesting, which a lot of people don't know. And it also, it's 20% of your thyroid is activated in your intestine. So if you have gut issue, dysbiosis, not good healthy probiotic, good kind of bacteria in your gut, then your thyroid could be low. So, and also progesterone, for example, is one of the hormones that plays a key role in thyroid activation, and people don't know. They could be running around with low progesterone and don't even know that, oh, I may have low functioning thyroid. That's the link. So gluten, we'll get that off, and then let's say patient come, they see some improvement. Some cases I see fully reversed. Totally thyroid, no more antibodies, they're feeling great. Thyroid is functioning fine, but in some cases it may not be enough. Then what I do is Epstein-Barr virus. I do check for that antibodies against Epstein-Barr, because Epstein-Barr or other viruses and even other bacterial infection, it's not specifically just Epstein-Barr, but this is the most common we do see that can cause Hashimoto, can make your body develop antibody against your thyroid. And Epstein-Barr virus, how do we treat that? It's different way. It could be inactive in your body. You may not have any symptoms. You may not have swollen lymph node or fever or chills, no active symptoms. But at cellular level, it does affect your thyroid and affects your cells. So what we do is we do the ISIAC-T is a good way. There's multiple ways to get rid of viruses in your body. Ozone.
What about colloidal silver?
Colloidal silver. ISIAC-T, as I said, those are, I usually start people on ISIAC-T and then add colloidal silver, a tablespoon, a couple times a day. That tend to, and sometimes if it doesn't work, then high doses of IV vitamin C, that can help. Interesting part is I'm just treating a patient who came in with dizziness, problem with inner ear, went saw ENT doctor, had a scan of the brain, MRI normal, everything, then end up doing a IV vitamin C, killed the virus, the inner ear, the dizziness is almost gone. Isn't that fascinating? What viruses can do to us? It also suppresses our immune system, can lead to other cancer, for example. So then number 3 could be parasite. Parasite also can trigger thyroid antibodies and cause Hashimoto. But thyroid parasite is really hard to detect because you go do a stool test, it's not going to come out. It's stuck to your tissue, it's stuck to your organs. So they don't really come out until you kill them with natural herbal or medication, but it's hard to get the diagnosis to get the actual medication. So one trick I usually use is garlic enemas. I have some patients do it around full moon. That's when parasites are active. That's when you could get rid of it. Or also bioenergetically, they could be tested for parasite. You could do the stool and ova test. Most of the time, it's negative. Problem is a lot of people are infected with parasite. They're not even aware of it because the hydrochloric acid in our stomach is low. A lot of us are on PPIs, antacids. What does antacid do? It blocks, it brings that stomach acid low. Now bacteria like H. pylori can cross, parasite can cross, and that causes a problem. So parasite is one of the main issues too with Hashimoto. Once those 3 are solved, most likely you won't have.
Can you list them again?
Gluten,
Parasite.
Epstein-Barr virus, parasite. Yeah. And then how do you fix your thyroid? The problem is a lot of people have low functioning thyroid, they get the T4, but your body uses T3, you see, and you get the T4, you need iodine, and you need good functioning gut to reverse too. So iodine is important for reversible of T4 to T3. And sometimes you could have this important to check your reverse T3 because that's a bond T3. Your body doesn't use that. Your body uses free T3. But what does a lot of doctors do when they check your thyroid function? They just check a TSH or free T4, which is not good at all. You want to do free T3 and reverse T3 are important.
Both.
Both. Sometimes TSH can be suppressed. You think, oh, I have elevated thyroid, but your thyroid is still low. That could be issue with hypothalamus and pituitary. It could be other issues. So, any question in terms of Hashimoto?
I definitely have a question. I am at the tail end of my cancer journey for a
Yeah.
while,
Great.
and everything is great.
Fab.
And now, so I've been through parasite cleanse, and I've been through a lot of things, but now my thyroid is showing up still normal, but at the very lowest level. So it's been recommended to me is maybe I would like to consider going on thyroid. But that opens up like a whole can of worms for me because like I don't know if I want to play with just thyroid or if I need to look at the whole hormone panel, if I have to marry that forever.
So
Like,
one
it's,
thing,
it's a little bit low, and I think that she looked at I think I remember seeing the T3 on there, but I don't know if both of the T3s are on there. But she just said the whole thing is a little bit low,
yeah.
and I'm not sure what to do.
Yeah, so first thing you want to make sure all the hormones are good, your progesterone, your DHEA, because both of them play a key role in your thyroid function. So
I think
if you're
I was diagnosed with everything being low.
yeah, so make sure you're on adrenal supplement, make sure you're using progesterone cream. Both of them should be used. Then next thing you want to add is iodine. Iodine is great. Sometimes it's controversy with Hashimoto. They say do not use iodine, but you could use high doses of iodine. Would be okay. You don't want to use low dose of iodine when you have Hashimoto. But so iodine plays a key role.
Does the
And
whole
then-
thing have to be balanced though? Does everything have to
The
be
main
balanced?
things are progesterone and adrenal and iodine. These three are important.
And you can't mess up with that? Like if you, like then what happens to all,
Then-
like pregnenolone and estradiol and like all the other stuff? Do you have to, everything, it's like one big concert or can you pick
Yeah.
and choose?
Ideally, I mean, you do want to fix your pregnenolone because if you fix your pregnenolone, your progesterone will be fixed as well.
So
Pregnenolone is a grandma of all your hormones. That's what I tell all the patients. Pregnenolone becomes progesterone, becomes aldosterone, becomes estrogen, becomes all the hormones, whatever your body needs it. So pregnenolone is important. Going back to thyroid, like for example, doing Synthroid, I don't think is the best thing to do because Synthroid is T4. What did I just say your body uses?
T3 and reverse.
T3, free T3. Reverse T3 your body doesn't use, it's bonded to protein. But T3 is the key, so you want to use maybe T3, you know, Cytomel, or you could use Nature Throid, Armor Throid, desiccated thyroids.
It's just, it's a big topic.
Yeah, but if you want to not get started right away with thyroid, I would say fix the gut. Make sure you have good amount of probiotic bacteria in your gut. Fix your progesterone. Give yourself iodine. Give yourself selenium. Selenium is important for thyroid function as well. How do we get selenium? Very simple. You don't need to get supplement. You just eat Brazilian nuts. Basically 3 nuts a day.
What about iodine?
Iodine is good to use.
How do you get it?
So I always put a drop of nascent iodine. See, I have it here because of this morning I saw a patient. Put a drop in their wrist, and then I tell them, check this. If this is stay with you till tomorrow, that means your body has enough iodine. If this disappears within few hours, that means you're very deficient. You need more iodine. And I talk about the importance of iodine in a second. If it stays with you to tomorrow, if I have this to tomorrow, that means I don't need any more iodine in my supplement. Unfortunately, majority of us are iodine deficient. Because we used to have it in our salt, we don't have it anymore. We don't consume so much kelp and ocean, you know, like Japanese people, seaweed, and You're not getting iodine. Iodine protects us against radiation, binds to radioactive material and gets it out. Iodine protects us against virus. Iodine convert the thyroid, as I said. Iodine convert the estrogen too. So it plays a key role. It's a good mineral to be on. It should be part of your guys' multivitamin. You could always do this simple test. Put a nascent iodine on you, see if it stays to tomorrow. But one problem with iodine is you can't take high doses, because then bromine and chlorine, which are bound to your thyroid because you were deficient in iodine, are released into your bloodstream, and then gives you foggy brain, tiredness. That's high from you. When I started myself on iodine, I took a pill, I didn't know, and then I had such a foggy brain. I'm like, shoot, I can't think. Seeing patient, I can't think. Then I realized, oh, I took too much iodine. Then I just started with the drops. I've been doing drop on myself for years now. Finally, I'm good. It used to disappear within an hour or two.
So you're using the drops, like the sample
I
drops
use the
to kind of-
yeah, exactly. I use the drop as a treatment
helps
for
you as well.
myself because I can't do high dose. Maybe I am able to because I grew up in Sweden swimming a lot in chlorinated pool. So chlorine binds to your thyroid as well. You know, thyroid has T4 has 4 bind for iodine. So when you're deficient, chlorine, fluoride, bromine. So I'm not using fluoridated toothpaste. They put enough fluoride in our water. That's why doing reverse osmosis is a good thing, getting fluoride, everything out. Or get a water filter that removes the fluoride from water. We don't need that. In Europe, people don't use it. In US, we do, unfortunately.
Do you think that if you wanted to affect your thyroid and you just maybe did a little bit of natural progesterone cream and a little bit of iodine, that you would be amiss because the rest of the hormone panel would be neglected?
No, that would be a good thing to start with.
Because I just have,
Iodine.
I'm just a little bit hesitant to start with the whole panel.
Yeah, you could do progesterone cream, iodine, and then eat selenium, Brazilian nut, three a day. It's
And-
a good source of selenium.
And that's not going to be lopsided or, oh, you missed out on testosterone and pregnenolone.
No, you could start
You
with
could start
that.
and not be messing yourself up.
Yeah,
Okay.
yeah, you could start
Fair.
slowly.
Yeah.
Do that for a month. Fix the gut too.
Yeah.
Because as I said, 20% of your thyroid is activated in your gut.
I take that Restore.
Yeah, that's
Is
great.
that a good way for fixing the gut?
Yeah. You're
Okay.
yeah. Go ahead,
Well,
sir.
when you say fixing the gut, if someone is diagnosed with leaky gut syndrome, which causes autoimmune, how do you diagnose leaky gut? And if you are diagnosed, how do you cure leaky gut?
So there is specific tests that you could do. Genova has a test to find out if you have leaky gut. It shows malabsorption.
What's it called? Nova?
Genova
Genova.
is by Genova. It shows malabsorption. And then there is the different gut product that you could use. We usually can energetically test the patient to see which one would be good. Like some people take L-glutamine. But L-glutamine, if you take 1,000 milligram, that's fine. But if people take like 5-6 gram of it, and if you have some cancer or something in your body, you're feeding the cancer. You don't want to take high L-glutamine, for example. 1,000 milligram or 2 gram, 2,000, it's fine, but not high doses. There are a lot of people are seeing their homeopathy doctor and they're on high doses of glutamine. You want to make sure you don't have anything. But then, yeah, you could. Celery juice is good. That's high. It gives you glutamine. Fixing the gut. You may just need to fix it with overgrowth. You may have overgrowth of bacteria in your gut, and the probiotic and taking stuff to kill the overgrowth of bacteria. That can be helpful.
Dr. Vita, someone wanted a clarification. Should you recommend them to do high doses of iodine or very low dose?
With Hashimoto,
Mm-hmm.
Hashimoto high doses of
High
iodine.
doses, I see.
Yeah.
And what about the SAFT that you recommended, and then ozone and colloidal silver? Take
Those are for Epstein-Barr virus. If you do the test, the antibodies are positive, then you do SCACT, you brew the tea 2 ounces twice a day. You could do that by itself for 3 months, and then we check your antibodies against Epstein-Barr. If it's effective, you're gonna see the antibodies go down, or you do colloidal silver,
2 tablespoons.
1 tablespoon twice a day. Yes.
So my daughter has Hashimoto's, and she has Epstein-Barr. What about mono? She had mono.
That's what it is. Mono is due to Epstein-Barr virus,
What
correct.
about breast implants? Is that?
I heard breast implant can trigger autoimmune disease. And Hashimoto sometimes can be triggered by the high toxicity. I mean, I don't know the link, but I do know implants can trigger autoimmune disease. But I don't know how.
So if you've been on medicine for a long time, can you actually get off?
A thyroid medication for a long time, it depends. You might have suppressed your thyroid. I say it is, you may, I mean, I have patients who I've been getting them off of it after a few years of being on it. Then the thyroid started improving after fixing all the glands, the adrenal, the fixing progesterone. The thyroid started improving. So then we slowly tapered off their thyroid. The best way to find out, does my thyroid function right? Am I basal body temperature? Sometimes you can't just go with numbers of what your thyroid is showing. You could do basal body temperature. The first morning body temperature we have handout for patient, and if it should be higher than 97.4. Average, do you guys know what our body temperature should be an average throughout the day?
96?
98, over 98, 98.1, 98.3. Should be 98 and higher. You don't want to have lower body temperature. First thing in the morning, 97.4. If it's less than that, that means you're most likely your thyroid is low functioning.
Still functioning?
Low functioning. But you want to rule out low iron. Iron can cause low extremities, low blood perfusion.
And those overlap a lot too, right?
Yeah, because sometimes they have parasite, which sucks the iron. I've seen a lot of patients with parasite showing iron deficiencies, and they don't know. I'm like, if a male comes with low iron, I'm like, what? Why? Either parasite or losing blood, or you're fully vegan and not supplementing it. And yeah.
What kind of liver cleanse do you suggest doing?
Then we have core restore, we have liver flush, we have 21-day standard process, liver detoxification. Simplest, cheapest way is also put yourself on juicing, and then maybe take milk thistle. Milk thistle cleans the liver. Some people do coffee enemas.
And over time, a coffee enema is going to help your clean your
Clean the
liver.
liver, yes. Yes. Any other questions out there?
No questions online. Does anyone else have more questions?
Yeah, go ahead.
I've been reading a lot. Can low dose naltrexone also can help the thyroid, right?
Yeah.
It helps the issues that are.
Autoimmune, yeah, it can elevate your natural killer cell. Low dose naltrexone, some people take for different kind of autoimmune diseases, and indirectly can help. Yes,
Starting to hear some.
yeah,
My friends with Hashimoto's are starting to have some good results. Which is
yeah, yeah, and I seen it with rheumatic arthritis, low dose naltrexone, and other autoimmune diseases. Yes. No.
I have some issues with my thyroid and adrenaline.
Okay, I can help you. Any other question out there?
Someone asked if there are any benefits to drinking aloe vera juice.
Aloe vera juice, you usually recommend aloe vera gel because it's less sweet than juice itself, but aloe vera juice is okay too if you don't have issue with sugar, if it doesn't spike your sugar high after drinking it. It's good to heal the gut, heal the stomach. If you have issue with HCl, issue with acid, you have heartburn, you have GERD, you have inflammation in the stomach, gastritis, esophagitis, all that, aloe vera gel is helpful. Yes. Or aloe vera juice they could have as well.
Does the ketogenic diet help Hashimoto's? Like what Liliana
In
does?
terms of gluten-free diet, yeah. Sometimes the paleo diet. Paleo is good.
Someone asked, what foods what foods should I avoid for Hashimoto's?
Sometimes that's a good question because a lot of people do a lot of juicing with spinach and kale. Sometimes cruciferous vegetable, too much of it can have a negative effect on our thyroid. So I always tell patients do not juice too much with kale and spinach every day. But baseline, I tell patient cucumber, celery, cilantro, parsley could be your base because cilantro, parsley detoxes you from toxins and heavy metal. And then cucumber and celery are great too, have vitamin B6, a lot of minerals, is good. And then you could add other stuff. Green apple is great too. But then you could add kale and spinach sometimes.
And I guess this will be the last question for the night. Will your hair grow back if hypothyroidism is treated correctly?
Yeah, and once the hypothyroidism is corrected, your hair will grow back, absolutely. That could be one of the initial signs of hypothyroid. Or beside elevated cholesterol even can be early sign of hypothyroid.
All right. Thank you so much, Dr.
Thank you.
Vita. We'll wrap up practitioner Q&A. Thank you everyone for coming and watching. If anyone has more questions, I'll leave an email in the comments. See you
Oh, I
next week.
forgot to mention
Oh.
this book, guys. Why do I still have thyroid symptoms? This is a great book to read. It's by Dr. Karazian. Really explains everything in detail. This is a great book. Like thyroid patient that started on Synthroid, but they still have thyroid issues, but their blood work looks normal. So I highly would recommend this book. Why do I still have thyroid symptoms?
All right. Thank you, Dr.
Thank you.
Vita.
Thank you.